Everyone, my name's Lindsay and I'm also joined by Tom today. Today we're going to be talking about ovarian cancer as part of Women's Health Week. So ovarian cancer is something I think many people know very little about, and that's including myself. So today is a great opportunity for upskilling. So the UK is one of the highest occurrences in Europe, and studies have shown that two-thirds of women are diagnosed late. So let's go back to basics. What are the ovaries? The ovaries are part of the female reproductive system. They release an egg every 28 days, roughly, give or take. And this is from when you reach puberty all the way through to the menopause. So unless you're pregnant, the eggs basically shed within the womb lining, and this is what we call the menstrual period. During this time, they also produce hormones, and this is to help control the menstrual cycle. So as you move towards the menopause, they gradually stop working, and this means that the eggs no longer produce and our estrogen levels fall. What are the associated factors with ovarian cancer, Tom?
Yeah, so there are some unknown causes. Sometimes, in some cases, there are just no factors whatsoever, and they kind of just crop up, sort of right from behind, and you don't really see it coming. You can have it in your family history, so it can be hereditary in the genetics. Whether you've had on fertility treatment or not, or used talcum powder. Obviously, certain age groups. Most people sort of around the 50 age usually increases by about 84% roughly. Whether you've had the HRT or not, the hormone replacement therapy, which we spoke about in the menopause section, if you haven't watched that, go and have a little watch of that. Endometriosis, whether you take the contraceptive pill, whether you've had children or not, and then whether you have breastfed or not. So a couple of different associated factors and things that can necessarily cause it, but can be associated with having ovarian cancer. But definitely some, if you have any of these, or if you're in any of these categories, or have experienced any of these, again, if you have any sort of symptoms, then definitely sort of take a trip to your GP and get that checked out.
So Tom, tell us a bit about the symptoms of ovarian cancer. I read an article from Cosmopolitan recently that spoke about bloating. So bloating is something that obviously many of us experience, and we tend to treat it as basically an inconvenient side effect, really, of eating too much. But according to research from Target Ovarian Cancer, 50% of women who suffer from regular bloating are basically dismissing it as just being normal, and so they fail to seek medical advice, even though it's actually a key factor, basically a symptom of ovarian cancer. They say that kind of many people just basically change their diet and do this instead of heading to the GP. So it's a really great time to raise awareness, really, to basically stop people risking their lives instead of just going to the awareness. And it really just comes down to the fact that people aren't aware of the symptoms. So it'd be really good if you could just talk us through them, just to make people more aware, really.
Yeah, absolutely. So with the persistent bloating, the key factor here to note down and to really kind of understand is that it is bloating that does not sort of go away. If it comes and goes, it is usually just going to be your normal bloating. But if it's persistent and it does not go away, and you're putting it down to, oh, I'm always bloated, then definitely something to just go check out. Something that, as you quite rightly mentioned, a lot of people do foresee this, and they just sort of let it go and as normal bloating. So yeah, if you see any bloating that is persistent and doesn't sort of come and go, definitely have a little look and speak to your GP. Whether you feel full quickly, or even a loss of appetite, any pelvic, abdominal, or back pains, that can definitely be another symptom. Any urinary symptoms, so needing to be more urgently, so more oftenly than usual. Changing your bowel habits, so whether you have any constipation or diarrhea, something to look out for. Extreme fatigue when you're going for runs, when you're sort of doing your sort of exercises for the day, even if it's going up the stairs, taking a washing basket up and down the stairs. If you are getting sort of extreme fatigue, definitely check that out. You shouldn't really be getting tired if you're walking up and down the stairs. So definitely take that into consideration. And any bleeding after the menopause sort of phase should always be investigated by your GP. So really, if you have any of these symptoms, especially with the persistent bloating as well, please do go and see your GP. That's a take-home message for today.
And tell me a bit more about how you get diagnosed with it.
So similarly to things like prostate cancer and the PSA levels, it will be a blood test, and you get your diagnosis from a chemical which is called CA125, and this level basically increases in your bloodstream when there are higher risks of ovarian cancer cells. So it doesn't necessarily say to you you have cancer, but it definitely tells you whether you are more at risk or whether the levels are in your body are elevated or not. You would then go and take further tests like CT scans, X-rays, or a biopsy, needle biopsy, to sort of test and really kind of break down the certain cells to see whether they are either malignant or benign, which essentially just means malignant is cancerous and benign just means that it is just a non-cancerous lump or something like that.
What about the treatment?
Treatments are relatively simple. I've only got 4 up here, so biggest one is your surgery, your ovary removals, or a hysterectomy, where they basically take out the whole womb. The chemotherapy, which is quite similar, quite traditional in any cancer cases. You've got your radiation, and you've got just constant checkups to make sure that this isn't sort of consuming you, making sure that it might be something to live with, but definitely something that you are able to live with and not cause you any sort of disruption to your day-to-day life.
So where can we go if we want to know more information?
Yeah, there's loads of different sites. You've got a few links here, I believe. So you've got your cancer research, you've got Macmillan, Overcome, Ovarian Cancer Action, Target Ovarian Cancer. So lots of different websites that you can go on to help you. Again, you can know more if you want to speak to your GP. Go have a little chat with them, and they'll be able to inform you a lot more about everything that you need to know.
Perfect. Thanks for that, Tom. If anyone has any questions or wants further information, then please get in touch with one of us. Cheers, guys.